morning. It's Nicole with Pinnacle. We're on the road today. We're heading to VitellaCare. Let's go. Hello and welcome back to Coffee and Coverage. We are excited to kick off our On the Road series, and today we are at VitellaCare here in Minot. I'd like to introduce Heidi with VitellaCare, and thanks for having us today, Heidi.
Well, thank you for coming. I'm excited to be here.
Yes, thank you. Okay, so first off, why don't you just start by telling us a little bit about yourself?
Okay. I'm Heidi Peterson. I am a family nurse practitioner. I'm originally born and raised in Northeast North Dakota. Attended the University of North Dakota and North Dakota State. So I tell people I do not have a favorite.
Oh, yeah. The big rivalry.
Right. I finished my master's in 2006 and have been in primary care, family practice since then.
Okay.
Working at Medicare, Manor Care, and 2008, I started at Minot State University, where I spent the majority of my career working in the student health clinic there. 8 of those years, I was adjunct faculty for the nursing department. In 2021, I started at Northland Health Centers, where I did family practice for persons of all ages, working primarily in Minot, but also providing coverage in the rural clinics such as Turtle Lake, Obells, Ray. And I did that for about 4 years before starting at VitellaCare last December, and I'm excited to be here.
Yeah, well, good. It sounds like you've had quite the career, which is amazing. So, why don't you tell us what you guys offer here at VitellaCare?
All right, we offer primary care to persons ages 3 and older. And what that includes, we do chronic care such as treatment of diabetes and asthma, high blood pressure.
Okay.
We'll also see acute visits, so those sore throats, coughs, colds, injuries, welcome to come in here.
Okay.
We really try to incorporate preventative care into all of our visits. So making sure those immunizations are up to date, those cancer screenings are up to date.
Okay.
We offer tuberculosis screening for sexually transmitted diseases. So the whole realm, trying to get the holistic approach.
Okay. Very good. Where do people go to see if they have an eligible plan? So because it's VitellaCare, does it
Sure.
work with all insurances, or how does that kind of go together?
Okay, so any eligible member has a Blue Cross Blue Shield of North Dakota plan.
Okay.
And so how you would find out, am I eligible? I have Blue Cross Blue Shield of North Dakota. You would go to the bcbsnd.me
Okay.
website, or there is an app that you can also download. So
Okay.
yeah, that's bcbsnd.me.
Okay. Very good. So if you're on Medicare, like 65 and older, do you have to have a Blue Cross policy as well? Or can you have like any policy?
At this time, we do not see Medicare or Medicaid.
Okay.
We see select Blue Cross Blue Shield of North Dakota plans. So it's not every plan. You really need to check into that bcbsnd.me
Okay.
to check your eligibility.
Okay. Very good. Thank you. What would you say a typical wait time is to get in, let's just say for a regular visit, or if you're not feeling well?
Oh, same day or next day at this time.
Okay.
We always try to keep a few acute care time slots open so that we can get those
So if
established
you're not
care
feeling
people
good,
in.
more than likely you can call and hopefully get in
Absolutely. Or
shortly.
schedule online.
Okay. Oh, or online. Okay. So we talked a little bit about the services, but there is also a mental health side. Is that correct? And so
Yes.
what would that look like, and how long does it take to get in for a mental health visit?
Same day or next day.
Okay.
We have Troy Ronas here, who's a licensed counselor that does
Okay.
individual counseling. And I also do medication management for mental health also. So we
Oh, okay.
collaborate together. Some common things that we see for mental health are anxiety, depression, ADHD.
Okay. Okay, very good. Do you guys have medications on hand or do you work with a specific pharmacy when it comes to prescriptions?
We don't have a specific pharmacy. We do have a really nice selection of medications that we give out here that are no cost to our members.
Oh, okay.
They're more for acute or more urgent care situations
Right.
like antibiotics, antihistamines, anti-inflammatories.
Okay.
We use an electronic health record. So if we need to send blood pressure medication, for example, we can send that to the pharmacy of the member's choice.
Okay. Very good. Um, so you're talking about wellness earlier. Do you guys also offer sports physicals?
Yes, absolutely.
Okay.
We love the physicals to come in.
Okay.
We do prefer that they're part of the well child visit. Here at VitellaCare, we have the ability to do the audiology screening, the hearing screens, the
Oh,
vision screens, go through that growth and development, update those immunizations. So incorporating that sports physical into that well child is just perfect.
yeah. Very good. Okay. So what would be the difference between going to a VitellaCare clinic versus a traditional clinic?
Good question. I really feel like here at VitellaCare, you're getting a very comprehensive visit at the most cost effective price.
Okay.
Um, there is just a lot of things here that are available at no cost, such as those urgent medications. There's no charge for EKG. Um, we vaccinations, there is no charge. We also have a lab here where we're able to do cholesterol screens, metabolic
Oh,
screens, hemoglobin A1Cs, those strep tests, urine dips. So all of those labs which are completed in the clinic, there's no cost to those, which is just a huge benefit to our members.
oh, that's great. Okay. Do you offer virtual visits? And if so, how would that work?
Oh, yes, absolutely. Those can be scheduled either through a phone call or online. Um, Once they're scheduled, they'll receive a reminder and an email. There will be a link that you'll go to on the email where you just click on it a few
Okay.
minutes before the visit. I will come on. We'll do introductions. I usually start out with verifying your location. That's very important. We also will, verify that phone number just in case there's an internet a connection that goes down. Um, I like to do the virtual visits. I like to do like something that would be appropriate would be an established care visit. If you want to get in, go over that history with me, just get to know each other, and we can schedule that physical exam later. Or maybe it's a medication recheck. We started you on like an antidepressant,
Mhm.
and I want to know how it's working, how you're feeling, go through that side effect profile.
Okay.
That's a great virtual visit, and it's convenient for people who are busy and
Yeah,
working.
very, very true. Okay, so as we showed at the beginning of our video, here in Minot, you're located within Trinity Hospital. Is VitellaCare affiliated with Trinity, or what's the connection there?
VitellaCare is located inside the Trinity Medical Office building, but we are a separate entity completely.
Okay,
We're independent from them, being that we are owned and operated by Crossover Health.
okay,
All of the staff and providers here are Crossover Health employees. So
okay.
we have our own electronic health system, we have our own portal for communication with our patients, um, just like any other system in Minot would have.
Okay. Are there other VitellaCare locations in North Dakota?
Yes. Shortly after we opened, Grand Forks opened, and last May we were excited to do the grand opening for Fargo. So we're hoping
To
that
continue to
they take
expand and
off and
oh,
expand,
good,
and we'll hopefully get the word out.
good. So before our interview with Heidi, I found out that Marantz, one of our benefit consultants, has paid to visit at VitellaCare. She had an appointment here. We're gonna check in with her and we're gonna learn about her experience as well. Just as like a feedback from a paying customer.
So I gave VitelaCare a call to see if they could help me with something I had going on, and see if that was something that they would look at. I know, they do some preventive and primary care. So I wanted to see if this is something they'd see me for. I talked to Chelsea. She was great. She said, come on in. We can see you today. So I went in and it was very personable, very small waiting room, which is nice. You know, you're not in a crowded waiting room because they're not going to have those long wait times there, is how they explained it. And then I visited with Dr. Heidi. So she was awesome. She was great. She sat down, she explained everything to me very well. And then she also followed up. So on the app and through the email, gave me extra stretches to do, how to better it and maintain. And then if there, is no progress, on how to follow up with her. So they were great. I loved the experience and I'm definitely going to be going back to them.
Is there anything else that you would like the audience to know about VitellaCare?
Yes. I'd like to talk just a little bit. In addition to our primary care services and our mental health, we also have access to care navigation, which is a service provided by Crossover.
Okay.
So, any patients that need imaging or a referral, for example, if we send somebody to physical therapy, our care navigators are going to be contacting the members through the portal and assisting them one on one with setting that up and facilitating communication back to us at VitellaCare, which is amazing.
Okay, very good. Where can people go to find out more information and how to schedule an appointment? So we did talk about online, and then
Yes.
what else would be an
Um,
option?
I tell people best thing to do, Google search VitellaCare. We have a vitellacare.com/about website.
Okay.
And that's going to give you the bios of all the providers, all the staff here, our hours, services we provide, just in more detail. So, and you're always welcome to give us a call, stop
Okay.
in. We love to see the traffic through the doors here.
Sure. Okay, well, thank you, Heidi, for joining me today
Well,
and
thank
taking
you
the
for
time to
having
answer all these
me.
questions. You did
Yes, you're
great, and it
welcome.
was such good information. If you are an employer who wants to see if your plan is eligible for these services, you can give our brokers a call at Pinnacle, at 701-858-0058. And then also just stay tuned for information coming soon on our next On the Road episode. Until then, thank you for watching. And remember that coffee is optional, but coverage is not. Thank you.